Hi, welcome to my channel. This is Dr. Erica Onagbola, pharmacist for close to 10 years now, owner and founder, CEO of Millennium Pharmacy. You are joining the new podcast series that I've started called Career Survival. Now, this particular video in this series is going to talk about glass ceiling. Glass ceiling is a very important discussion because at times we may be faced with a glass ceiling after we have implemented so much of our work and time into the business or corporation world. So stay tuned to the end of this video. Thank you for joining me. This is Dr. Erica Onagbola, pharmacist. I'm going to talk about glass ceiling. The glass ceiling effect affects so many individuals in this country, especially those who are minorities as far as sexual or gender based, and also those who are race based minorities, such as African Americans, foreigners as well, have been affected by the glass ceiling. The glass ceiling is a phrase or a discussion where we see the elevation and the height at which we can accomplish in our field of study, but then there's the actual material, the tangible material of glass that we sometimes embrace as we climb up in our role in our careers. And so that glass ceiling can be a surprise to some people. Some people do expect the glass ceiling at some point in their career after so many years and so many contributions to their corporate bosses and so forth. So the glass ceiling can again be a surprise or it cannot be a surprise. So some of us as women, we do expect the glass ceiling, especially after childbearing and being in marriage and so forth, and also being a woman. We feel that the glass ceiling may be reached a little bit sooner than some. So the glass ceiling, I have personally or professionally have not reached the glass ceiling because I have been in pharmacy management. I've been a pharmacist on standby or an intermediate pharmacist on call. I've been in clinical pharmacy, retail pharmacy. I've even been at the point where I was out of uh, the out of work because of certain situations. Now that I'm back as an independent pharmacist, as someone who works for myself, that glass ceiling has been removed because I am my own boss. I am my own CEO. I can determine when, what time, how I would like to retire or resign from work. The glass ceiling effect in corporate world is very much real, and it is a a phrase that I've learned early on in my career because I've watched people as they go along talk about the glass ceiling effect, and most of these people again are minorities, women of older age who've come up in their career and are stopped by the glass ceiling because they are again thought about in the corporate world as someone who's not able to elevate any further. Now, do take in consideration a tier level in the career, one who has tenure, one who is not tenure. Being tenured means that you have access to your job no matter what conditions, what compensations may be met or not met. So the employee, him or herself, meets tenure. They are successful. They've proven their work. They're accountable for their work. They have a history of successes, and they are now put in a place where they have met all requirements, all objectives, so they are there to stay. Now, some of us who have been in the corporate world know that this is not always true for everyone. You're faced with tests, you're faced with um, peer review, you're faced with feedback and follow up. All of that plays a part in how far you will go in your career. Now, being a medical professional helps you maintain a certain type of tenure because medical field is always needing individuals, always seeking out those good individuals to perform great work in medical field. So it is easy to maintain a job in the medical field, especially if you're not one who is submerged into science and mathematics and the medical fields per se, but you're more as a receptionist or as a courier, as a biohazard worker. You are able to maintain a certain level of stability in your career just because the medical field needs and wants and appreciates your presence. Being outside of the medical career in the corporate world is where most people will feel that effect of the glass ceiling. The glass ceiling is very much real, it's very tangible. Again, some people see it and can know that they're approaching it. Some people don't see it, and it's a surprise to them because of the effect that the glass ceiling gives to one in their career. Now, again, medical field is a great way to go if you are wanting stability and career survival. If you know someone who is about to face the glass ceiling or someone who might be going to a career path where the glass ceiling can be met early on, do encourage younger individuals to try out the medical field. Also, science and science majors have another type of stability as well in their careers because science, engineering, mathematics, technology is always growing. And so those fields are always testing and always seeking out those advanced individuals. The key word there is advanced individuals who are able to succeed in those areas of studies. Now, those areas of studies are not for everyone, but do be mindful that the glass ceiling is less effective in the medical field and in the science field as well. So I do encourage that. Now, how to overcome the glass ceiling effect, one can either retire early, one can either resign, one can either take an alternative career or secondary supplemental career as well. I've seen people do all of those. Again, that's resigning, that's retiring, that's choosing other opportunities in other career settings to help bypass the glass ceiling effect. Now, being in the corporate world, there may be stipulations to that. There may be some sort of a system that they may incorporate. But then again, there's also independent work in the medical field and in science fields as well that require certification and higher education studies. So that is a great way to go. College, collegiate level science, math, and technology and engineering is the way to go if you want to maintain a certain stability in your career path at an early stage. So do be mindful of that. So that's all I wanted to share in this particular video on my new podcast by Dr. Erica Onagbola. Thank you for joining me. I hope that you like, share, and also subscribe to this channel. And I hope to see you on the next video. Take care. Bye-bye.